Privatization of Canadian healthcare has been a long-standing continuous issue that has sparked debate among Canadians. Opposing sides have argued that privatization threatens equitable access to healthcare or that it is a necessary solution to meet the staffing and care stresses on the public sector. Advocates of private healthcare have risen in popularity as it is the preferred choice of receiving faster care based on a patient's financial means.
The CBC News article, "Would More Privatization in Canadian Healthcare Solve the Current Crisis?" is a response to Ontario's Minister of Health announcing that Ontario would be funding additional procedures privately as a means to alleviate long wait lists in the public health sector. This announcement reignites the ongoing debate on privatization. In presenting both sides, Miller and Shingler present opposing viewpoints on the issue. In this presentation, the topic of two-tier healthcare systems is addressed to bring insight into how healthcare will be improved or deteriorated when the determining factor is financially motivated.
Sage Journal's Two-Tier Healthcare After Canby examines a court case restricting private healthcare. Throughout the article, Canby's pro-two-tier healthcare perspective is challenged and the possibility of inequity is highlighted. Flood considers current healthcare challenges like long wait times and identifies solutions like central triage and wait time guarantees. With this article, advantages and disadvantages of two-tier healthcare are presented through the real trials and tribulations of a 2019 court case.
For your article, Rethinking Canada's Unbalanced Mix and Public-Private Healthcare by Ballamans and Bubsey 2015 states how 30% of Canadian healthcare is privately paid for, which is the same proportion as the average of 34 individual countries that are the members of the OECD, which is an organization for economic incorporation and development in Canada. Due to that reason, many individuals argue how combining public and private healthcare in a hospital setting is unusual and rather be its own separate thing, as it limits access to long-term care, dentistry, or vision care. On the other hand, other argues that the government in Canada pays for all medical service and acute care within the hospital, whereas the budget of the healthcare is more money spent on the hospital and physician and less money spent on the aspect of healthcare.
Private healthcare may take the pressure off of hospitals and aid in the staffing crisis after COVID-19, but it has the potential to bring rise to many other issues of marginalization and inequity. These issues can then go on to ultimately alter health outcomes of Ontarians.
Williamson and others 2006 states that a group of low-income individuals living in cities such as Toronto and Edmonton are experiencing a rise difficulties in accessing healthcare services that are publicly funded hospital by the government. Due to those reasons, individuals are waiting long time within the healthcare to get effective care, yet these certain challenges for low-income individuals are faced with displayed and restricted aspect of healthcare. For instance, individuals with low income are limited to certain services such as reaching to dental care, prescription and medication, or counseling with a psychologist. In conclusion, individuals with low income in Canada are more likely to experience an increase of medical conditions or illness that undergoes with their symptoms in comparison to individuals who have higher incomes to Canada who have the ability to afford effective health care. This can connect to the idea of health insurance coverage and rates in Canada. According to the National Library 2014, they stated how 60% of Canadians are covered by healthcare insurance, but most often as a benefit of employment. However, the insurance coverage in Canada are quite expensive and lack support between the ethnic, racial, or certain groups in Canada, which is causing increased difficulties for individuals to acquire effective care within the system. For instance, Indigenous individuals such as First Nations, Inuit, or Métis are finding it difficult to access primary health care due to the issues relating to the culture or social determinants of the health, such as employment or low education levels, that influence whether their marginalized communities are able to access health care.
According to the Ministry of Health and Long-Term Care, those residing in rural communities may also encounter challenges acquiring access to private facilities. In particular, lengthy travel times can reduce likelihood of choosing a private facility and may result in opting for a closer public hospital. Not only is time an issue, but availability of transportation like emergency vehicles can also hinder private healthcare access to these rural communities. Finally, new immigrants may be marginalized in the discussion of two-tiered healthcare. The differences in culture has the potential to create feelings of insignificance amongst newcomers. Specifically, gaps in communication due to language differences, instilled distrust in the healthcare system, and lack of culturally competent care are all barriers that may arise when attempting to acquire private healthcare. With all of these groups, access to private healthcare is hindered. This can create a members-only atmosphere within the private sector. The division of public and private can create barriers, boundaries, and invoke feelings of insignificance in marginalized groups. Specifically, it puts those with access to private healthcare on a pedestal and in a position of power, while belittling those unable to gain access.
For decades, the polls have revealed that Canadians support an equitable healthcare system grounded on the belief that every person has the innate right to receive quality care regardless of their socioeconomic status. Arguments against privatization are founded on the social justice ideology, which focuses on and seeks to address systematic inequities and disparities in healthcare. The Canadian Nurses Association acknowledges that social justice is consistent with the values set out in its code of ethics. Nurses can enact social justice in their practices through education and by advocating for equitable policies and care for all their patients. A social justice perspective is concerned with three main implications. Privatization undermines the principle of social justice because it creates an inequitable access to healthcare based on one's socioeconomic status. As referenced in the CBC News article, as more Ontarians fund private healthcare, resources available to provide quality care in the public sector will be redistributed due to the reduced government funding. And then there's the issue of reduced accountability. With for-profit healthcare, there would be less government regulations in terms of criteria for staffing, efficiencies, and quality of care, allowing healthcare to be run like a business for maximizing profits rather than quality healthcare. Universal access to quality care is only possible when policies and all stakeholders align to preserve and strengthen a public healthcare system that benefits and works towards the optimal health for all Ontarians.
Applying critical social theory is analyzing the underlying problems in a social construct. In this analysis, the focal point is how an issue can expose social, economic, and power relations within society. It is important to look through the critical social theoretical lens in healthcare with many debatable topics in the system, such as privatization. In response to multiple problems in the healthcare system, the government has opted to emphasize a partnership between the public and the private healthcare sectors. Doing so will take pressure off of public healthcare providers, allowing them to offer their services to those in need of treatment without the means of a private health service. The queue within public health services will be reduced as a result of this, possibly being a solution for short staffing of public facilities. This staffing shortage is partly due to the overhead costs within public facilities. Having this cost causes hospitals to lack physicians because of a lack of resources. This problem has become especially prevalent amid the pandemic, in which 600,000 fewer surgeries were performed from March 2020 to December 2021 in comparison to 2019, according to wait times for priority procedures in Canada. Government funding does not cover the costs required to solve the shortage. Consequently, those within the public sector must accept a partnership with private clinics to meet local needs. These local needs include those less fortunate suffering from severe illness. Thus, when applying critical social theory to the topic of two-tiered healthcare, it can be seen as a way of promoting equity. While the philosophies of nursing express the benefits and drawbacks of two-tiered healthcare, what are the possible outcomes?
First, let's talk about the salaries of healthcare workers. The medical overhead is the gross income a public healthcare facility earns apart from the salaries of its staff and currently accounts for about 3/4 of public healthcare systems revenues. While these overheads keep hospitals running, they also restrain the salaries of healthcare providers.
Additionally, healthcare workers can't benefit from practicing in both healthcare systems, with the prohibition of dual practice. The freedom to determine one's own salary is only accessible to those who commit to practicing privately.
Secondly, private healthcare markets don't economically function well. Although private systems allow raised salaries, how rewarding would this outcome truly be? First, if private healthcare drastically grew in popularity, the cost of private insurance would rise as well, eventually becoming too expensive and inaccessible for those of high risk, such as the chronically ill or elderly. In other words, those who need it the most.
In addition to costly insurance, healthcare workers could be another key factor to an expensive private healthcare system. In practicing privately, healthcare professionals would be permitted to overcharge for their services, leaving patients with few options if they urgently need treatment.
And thirdly, two-tier healthcare would inevitably divide both healthcare staff members and patients. If more patients chose to receive care from private healthcare facilities, those practicing privately would begin to earn more than those working publicly, considering the absence of overheads. In this case, nothing would prevent healthcare professionals from choosing to work privately, leaving public healthcare facilities understaffed and patient care quality in those facilities diminished.
On a final thought, if two-tiered healthcare systems are being considered, they should be decided upon based on the generalized needs of the entire population, rather than individuals. If it's really the best system for society, it would be one that favors patients' care rather than affordability.
Overall, two-tier healthcare is an ongoing concern for Canadians, and it comes with its own pros and cons. While it may have the ability to combat certain concerns, it has the potential to bring rise to many other complexities of equity and accessibility. Moving forward, consideration should be taken to create an optimal healthcare system with timely care that still caters to the needs of all citizens in an equitable manner.